I'm Dr. Darren Howarth with Summit to Shore Chiropractic. So today I was going to talk about hiking and knee pain. It's a common problem I hear in the office, and it's something that is a really common thing, especially when you live in Tahoe. There's so many places to go, but everything's uphill, downhill. There's not much flat around here. So a couple of the big things you have to be aware of is knee position. So anytime you're doing a lot of up and down stairs, anything like that, look where your knee goes relative to your foot. I'm not as concerned usually of that knee going in front of the foot versus inside or medial to the foot. So you don't want your knees to dive in towards each other. That's not great on the knee. Usually this is just one aspect of it. Hip strength and positioning is a big part of that. So one of the easy things that you can do to prepare yourself for some of these hiking seasons and big hikes that you're doing is doing squats. So putting a band, any sort of elastic band or something around the knees, above or below the knees, and do some squats, making sure that those knees don't dive in. So what you're doing here is, one is you can usually feel the hips turning on a little bit more and the gluteal region trying to turn on. And the other is you'll notice you have a tendency to push your knees out. And that's just a reaction to that band pulling them in. So you're actively getting those hips to work a little bit more, plus your body's understanding different positions. Because again, when you think about climbing down from a mountain, and especially when you get tired, you watch your knees as you step down some of these stairs, and you notice the knees will start to dive in as you fatigue a lot more, and that's just part of the aspect of you're getting tired and your hips aren't able to strengthen and stabilize that knee to keep it from doing that. So it's an easy thing that you can try. Just constantly work on it. That's going to be beneficial in so many aspects with running, hiking, all that, as well as, and then to push it a whole nother step further, is you should be able to squat and on one leg and to a degree keep that knee from diving in. That's essentially a walking position. Most of the time you're not on both feet stepping downstairs like a squat. You're on one leg. But if you can't do it on two, the likelihood of you doing it on one leg is even less. So it's a little tip for you, something to work on. Keep yourself going through the season. If you have any issues, you're welcome to come in and we'll take care of you and get you stronger and ready to go for whatever season comes along from there. Thanks for watching and have a great day.